Welcome you all to the Fitness for 55 Plus podcast, brought to you by StrongerLife, the gym for people over 55 here in Lexington, Kentucky. My name is Dr. Dustin Jones, physical therapist.
My name is Dr. Jeff Musgrave, Doctor of Physical Therapy.
All right, so today's episode, we're talking about the harm of diagnoses or putting a name on something and all the baggage that can come with that. This is inspired by one of our colleagues, so Dr. Lindsay Huey. She's a physical therapist and she teaches continuing education to other physical therapists with us. We do the same. We have an older adult class or course that we teach, about 3 of those courses, and then Lindsay has a course that she teaches that focuses on managing extremities, so your arms, legs, arthritis, different joint pain that many folks experience. So she's a colleague of ours, and she also owns her own clinic called Onward Wilmington. And she had an amazing post that really dug into the harm of labels. And so I want to read this from what she had to say. Labels always limit the human and care. It is not scapular dyskinesia, the acromion, posture, or lower trap weakness that is the cause of shoulder pain. These are not literature supported to be primary culprits. Pain is always multifactorial for the shoulder. And so she was talking about mainly the shoulder with this post, but we wanted to discuss it of how we see this play out in our careers and then even in this gym of StrongerLife, and just some big takeaways for you all, the listener, that may be a little bit different than what you typically hear in the healthcare system. So Jeff, you shared this first. That's how I saw it. Kind of what was your reaction? What were some of your thoughts when you saw Dr. Huey? I always call her Huey, but Dr. Huey.
Yes.
Share this post.
I mean, my initial reaction was hell yeah.
Yeah.
and the reason being is there's so much nuance to care and treatment, and I think when you're a patient, you want an answer. Right? You want a diagnosis. Do you know what's wrong with me? I mean, you're showing up because you don't know what's wrong. But the reality is there is truly very little to no literature, especially when we're thinking about the shoulder, for example, which the post focused on, that the acromion and a hooked acromion is causing your shoulder impingement, which is rubbing on your rotator cuff. And that's a problem. Because there's almost no literature to support that truly is the issue. But lots of people get that diagnosis, and it's like, well, if the problem is the anatomy, is this acromion, then there's nothing that can be done to fix it outside of surgery, which is very convenient if you're a surgeon. And I'm not saying, not trying to disparage surgeons at all. There are lots of incredible surgeons. Everyone has their own perspective. But me as a physical therapist, you get that diagnosis, but you watch people get better. You dig into what's going on with them specifically and realize, you know what? Actually, you just have a couple weak muscles and you're a little bit stiff. And if we do some strength training targeted to you, we do some stretching, and we maybe avoid a few activities for a period of time, all their symptoms go away. Their function is 100% normal. They're happy, healthy, and they move along. And the acromion did not change.
Yeah.
We didn't touch the acromion. And it is such a similar thing with osteoarthritis. Without enough context, and it's really tough because in the medical system, so few providers get as much time as they would like to have with their patients. So let me say that first. I don't know a provider who's yeah, I really love these 30-second interactions I get to have with my patients.
Yeah.
No one wants that, but that's a reality for a lot of providers. But because of that, there is little to no context when they throw out this anatomy. Your problem is this tissue. This thing is the issue, and it's often not.
Yeah.
It's usually there's something else that can be done to alleviate the symptoms. It's not accurate, and it happens all the time with osteoarthritis. I would have people come in, they didn't have a good context for what arthritis is, what it means, that it often occurs without symptoms, without any pain. You can have moderate to severe arthritis with no pain and no functional limitation. But it's really convenient if you come in for a visit and your knee hurts, as a provider, the tools those providers, especially in the medical field, have are x-rays and MRIs. And so they shoot an image of the anatomy and they say, well, the only thing I can see here on this picture is this. But we know as physical therapists and getting people moving that the health of your muscles, your joints, your mobility, how you move, how frequently you move, your nutrition, your sleep, those things can modulate all those symptoms with never changing the anatomy. Because we have people come into our clinics with moderate to severe osteoarthritis. And the funniest part is, sorry, this is a real soapbox for me.
I love it.
But like the right side and the left side, if they get images of both, are usually the same.
Yeah.
They're usually exactly the same. So if arthritis is the problem, then the other side should hurt just as much.
Yeah.
But either the other side is not imaged, or when they both are, the findings are not usually drastically different. It's very rare that the image gives you much insight at all. And a lot of the Con Ed courses I've taken have encouraged me to do my complete assessment based on functional movement and not look at the image until after I've made up my mind. Because it can bias you. But it's like if we have pain with movement, we need a movement assessment. And we need to look at the movement systems, not just shoot pictures of images. Another study, while I'm still on a tear here, there was one that showed that 70% of 70-year-olds, people 70 and older, will show a partial to full thickness rotator cuff tear. How many times do we have people come in here and say, well, I've got a cuff injury, old, new, complete tear, partial thickness tear. And that study showed that of those individuals, 70% showed a tear, but they were all asymptomatic people.
Right.
They were people that had no pain in their shoulder, but when you take an image, you find some abnormality in the image. And just to go further down the rabbit hole, what we're talking about.
I think we should clarify abnormality. Is it an abnormality? I think that's what we're getting at. Is it's not. And you'll hear lots of different phrases, but one that's really stuck with me is it's wrinkles on the inside. Like, it is a part of the aging process that we have these changes, but these oftentimes age-related changes don't necessarily equate to the pain.
Correct.
The pain that you are feeling.
Yes.
So I think that question of, is it abnormal, right? Like that degenerative disc disease. What if that is normal age-related changes and they're really starting to see them as normal, because there's people that don't have back pain that have degenerative disc disease based on an image that was taken.
Yeah.
Sorry, I didn't mean to derail you.
No, you just were clarifying, and I appreciate that because I'm just all pumped up about this. Because, I mean, we just run into that all the time in physical therapy where the patient is so biased by the image and the anatomy, and maybe the provider is too.
Yeah.
But our job is to be a movement specialist and see if there are other things that can be done to alleviate the symptoms. Their job as a provider is to use the tools they have. So oftentimes it's lab values, a subjective history, no movement exam or very little, and then imaging studies.
Yeah.
So I don't blame them for it, but the amount of weight that's put into the image is very questionable.
Yeah.
Same thing with like meniscus tears at the knee. Oh my gosh. Or meniscus injuries at the knee. Those are described as wrinkles on the knee. That's a sign you've been on this earth, you've been walking around, you've been using your body. And almost everyone's going to show one. And just so we're being clear, like that doesn't mean that's driving the symptoms. And I'm also not going to the extreme to say, you know, it's not like I don't believe in Santa Claus. Like I don't believe in rotator cuff tears. I don't believe in meniscus tears, because sometimes the tissue is the issue.
Right.
And some people need surgery. But even the insurance companies are savvy enough to say you need to go to PT first, because oftentimes we get people better.
Yeah.
And movement and strength training, if you get the right thing, oftentimes the symptoms are alleviated without changing the anatomy.
Yeah.
Which means we overweight the imaging study, which I think is where a lot of this thought process comes from. And it's like, name a body part and I've seen it.
Yeah.
It's like, if you just look at the image, it's like, man, this looks gnarly. Like, I don't know.
That has to be it. That
has to be
the
it.
problem. Yeah.
And then time and time again, I see people that commit to a process of strength training, getting a tailored solution for their problem, and their symptoms go away without changing their anatomy. And the insurance companies often make people go to PT before they're going to even do the next round of imaging, because it doesn't matter what the picture says. If all the symptoms go away, who cares?
Right.
It's just the damage that can be done mentally by thinking there's something wrong with your body.
Yeah.
And it's going to come back.
Yeah. And it's what's been interesting, you mentioned the shoulder, the knee, like that study that you mentioned where, we have 100 asymptomatic individuals. Asymptomatic mean they don't have any pain.
No pain in their shoulder.
And we take a picture, let's say an X-ray or MRI of, their shoulder. 70% of those individuals without pain are going to have a quote-unquote rotator cuff tear, but they don't have any pain. And so you take that study, that framework of that study, and that's been replicated at the shoulder, at the spine, at the hip, at the knee. And so a lot of these conditions and diagnoses that people will latch onto and the anatomy associated with that is just that's not the problem. What are so rotator cuff tear, osteoarthritis, degenerative disc disease, bulging discs.
Oh man,
it's another one. Meniscal tears, bone on bone, right? Like but all that to say, like they're, to an extent though, those can be drivers of pain or reasons of pain.
Yeah.
But it's far less frequent than what we perceive.
And it doesn't mean that the anatomy has to change to modulate the symptoms,
right,
or completely alleviate the symptoms. Yeah, such a great point. And yeah, it just it can do a lot of damage. And it's not that we, when people come in, we listen, that anatomy or that thing or that problem may be part of the symptom driver, but it doesn't mean that exercise can't help and nutrition and sleep can't help.
Yeah.
So it's we hold that softly, and we try to encourage our members to hold it softly too. Yeah. It's yes, you may have MS, you may have osteoarthritis, you may have any number of conditions or imaging studies that show you've got all these problems, but it's it doesn't mean you can't live a healthy life. It doesn't mean you can't be strong, you can't be fulfilled. And it's we take that information, but we put it in context with what we've gotten to see. And unfortunately, everyone doesn't get to see what we see.
Right.
Behind the scenes in the clinic can see those success stories.
Yeah.
But we've got a body of them now here at Stronger Life, which is really cool.
So many conditions that so many folks, there's fear associated with, or, you think, oh, they won't do X, Y, and Z, whether it's joint replacements, whether it's some chronic condition. The way that we view it now is okay, you have that? Cool. We're gonna do. You're gonna be able to.
We
do
still
things
need to see how your body responds.
Yeah, but it's not a death sentence.
No.
All right, this is on the table, and we're gonna work with it, and you're gonna be able to do amazing things. But an interesting interaction that I find a lot of entertainment in now, which I know you've had them too. But we'll have people that are probably new, and they come to us with kind of the laundry list of all the different, diagnoses they've received over the years. And, I have, bone on my right knee. I have degenerative disc disease in my low back. I've got a grade 1 rotator cuff tear in my left shoulder. And it's almost like the expectation from them is that I'm going to be very concerned about that. Oh my gosh, okay. And I meet them with less enthusiasm than what they are expecting. So
yeah, they're almost a little disappointed.
Yeah, that I don't
react
as much as kind of what they're expecting, because we don't perceive those. They're factors that we consider, but they're not huge limitations. We consider it, and we're going to work around that, but that is not a huge factor that we're going to say, oh, you can't do this, or you need to go somewhere else. That it's things that we're so used to that's okay, we've had so many reps at this, it's nothing that we cannot handle.
Yeah.
But yeah, I've noticed that where my reaction is not what kind of
okay, cool.
Expect.
All right,
awesome.
Into class.
Yeah.
And that's because we really don't know till the rubber meets the road, and oftentimes there's so much we can do, which is such a great hope-filled message that's so exciting to share with people. Right. Is not only is it not too late, but like that may not limit you as much as you were led to believe.
Right.
And it's like we just have the benefit of having the repetitions of seeing the imaging study, seeing the person, and then seeing them be successful anyway.
Yeah.
And it just like, you see that so many times that it's like, okay, cool, you got imaging studies. Like,
Yeah.
I almost don't want to look at them.
Right.
Because rarely are they helpful.
Right. Yeah.
Rarely are they helpful. Sometimes, but it's the exception instead of the rule. So we always want to like hold on for that exception, and like, just so you're clear, if you're listening to this, if it looks like there's a real issue with the tissue, with the anatomy, like we'll refer people, you know, to skilled professionals in the area. But it's so rare that it ends up being an issue. Right. We can usually work around it, strengthen around it, and life goes on. Oftentimes without surgery.
Yeah, there's
great.
There's that video we did. I think it's like 2 or 3 years at this point of this recording, but we asked all of our members, like, hey, what chronic conditions do you have? Like, what diagnoses do you have? And diabetes, heart disease, stroke, Parkinson's, knee replacement, hip replacement. And we filmed all these people doing activities and exercise that we do in Stronger Life that most people would not associate with that diagnosis. And so, you know, we have members lifting relatively heavy weights saying, I have diabetes, or I have Parkinson's, or I have a knee replacement, and they're squatting, for example, and just really challenging the narrative around a lot of these labels and diagnoses, and that's something that is very infectious once people join this community. I think that they meet other people that have overcome that label and proven to themselves, like, I can do this, I can change, and I can do better. And man, when you are in a group of people like that, the weight that you give that diagnosis just becomes less and less and less, to the point where you forget you even had it, you know?
Yeah.
For some, not all, but definitely for
it
for
becomes
some.
a non-issue. It reminds me of a story our head coach told us at our coaches meeting just yesterday. There was a new member that came in, new diagnosis of osteoporosis. They're seeing the weights in the gym, and they're like, talking to another member, and they're like, I don't think I need to be in here. Like, I don't think this is safe for me. And then 2 other members on either side of them were like, I have osteoporosis too. You're in the right spot. Let's go.
Yeah.
Like, we're getting in the gym. You're in the right spot. This is what you need, because they've experienced the other side of that diagnosis. And it's like, just want to be clear again, like, we don't blame anyone for wanting to find out where their pain's coming from.
Right.
It's just a lack of context around imaging studies and these labels on diagnoses, because there's no context given to them oftentimes.
Yeah.
I mean, I can't tell you how many times, because where I was practicing last was an orthopedic practice. It was tied in with the physician group, so I got access to all the imaging studies. And I looked at them, and it was kind of funny at some point, because like anyone who had an image of any joint after 18 years old, mild arthritis was listed. It was just like, it became laughable. Yeah. It's like, okay, there is signs you have been living on this earth. That's what that means. Yeah. Like the wrinkles, like wrinkles in the joint. Yeah. Like, it's getting used. Right. And that's normal. This is a normal finding. Yeah. Most of the time.
I love it. We could go on forever on this.
Yeah, you need to stop me.
But hopefully this is an empowering message, especially if you have a label, if you've felt the burden of that diagnosis and not necessarily know what's to come, what's the prognosis. That for a lot of these labels and diagnoses that are thrown around, there is a lot of hope, and we've got living proof of folks that are fighting the good fight and living lives that they thought were not going to be a reality after they got that label. So if you have any questions about your particular diagnosis, if you got that osteoarthritis diagnosis, bone on bone, whatever it may be, we'd love to hear your question, your take on this. And this is something that we love to put out into the world, because we feel like it is a very empowering message when people don't fully embrace that label and they actually see what they can do and then train and then see the results. But if you have a question, drop it in our Facebook group. That's Fitness for 55 Plus. Go into Facebook, search, and then request to join. That's where there's over 1,000 folks from all across the world that are over 55 that are asking some of these questions. and very encouraging community that we would love to have you in there. Thank you for listening, watching, whatever you're viewing this. If you found this to be helpful or encouraging, we'd also love for you to share it with someone that you think could benefit as well. All right, appreciate y'all for listening, and we'll talk to you soon.